also interesting, I say, when you feel like nanotoxicology comes off and you establish a new group of people who benefit in their eating risk of nanoparticles. And so the same kind of thing happens again. I remember I work in this area, and I remember my graduate student called me and told me, great news, those particles were really toxic. Because in fact, you can't really publish results with so you know biological effects of the nanomaterial and toxicity study. But I think I suppose it cuts both ways, and I think as science is becoming more and more of a business, it becomes difficult to ask scientists to comment objectively on things that somehow affect their research areas.
I think actually the self-suppression of negative outcomes that's a serious problem for pharmaceutical studies as well, and maybe there ought to be a publication source like like ActaCrist or something where you have a routine crystal structure or something. It's not a full scientific study. You can't really trumpet too much, but the result is interesting, and maybe somebody later will use it for a meta study.
JNR, the Journal of Negative Results.
Yeah, exactly.
It is hard to
so.
But partly it's because if you set up a system like full photovoltaics,
you make a material and shine light on it, and you get no current out. Maybe it's not a photovoltaic material. Maybe it's the experiment wrong in some way. It's hard to get something like that.
Can I add a comment on that? When C60 came out, people did toxicology tests, and everybody was scared that all the mice died or whatever it is. It turned out to be not C60, the THF or the solvents, which are sort of absorbed on it. So how you do these experiments also makes it very critical before going to the height what you're saying that it's scared.
Yeah, can I add something to that too? And that's one of the things that we haven't yet talked about that is part of the regulatory process that was up on the slide of that big space between doing and banning is the process of creating standards. And even before you can get to a place where you can do a science-based risk assessment, you need to have standard protocols for animal studies, for example. And before that, you need to have standardized production techniques, at least at some scale, for the materials that you're going to be testing, part of the definition problem. And so that space is incredibly difficult to try to figure out, incredibly time-consuming, requires an enormous amount of technical input with an eye toward what social uses that technical information is going to be put. And the NNI didn't get around to putting a real emphasis on environmental health and safety research until 2007, 2008. Some of the private bodies were involved in standard setting a little bit earlier than that. But one of the early promises about nanotechnology was in part because of that 2003 Act that I mentioned, was that we might be able to do nanotech a little bit differently than we had been doing, for example, GM foods. There's some significant evidence that we've still got it backward.
Part of it may also be a continued conversation that needs to take place with government and industry to let one of the results that we just got back from our 2010 survey that our colleague at North Carolina State published was that the public support levels for technologies when they felt they weren't being given an accurate evaluation of risks plummeted. Even
and I think this gets into a lot of what is public engagement and what's the purpose of public engagement. I mean, does the public really want to sit there and debate, is it, 4 parts per million or 5 parts per million? Or is the fundamental function of public engagement to give people confidence that the decision makers have their best interest at heart? There's a whole body of literature that I'm not an expert on in kind of those two competing views of what is public engagement. Is it a trust building or is it a substantive decision-making role?
I mean, science seeks certainty, but when you have something, a decision has to be made, you often are making the decision on incomplete or incorrect information. And then when more complete picture emerges, then the scientific community feels like it's been accused of flip-flopping, as if there were something wrong with changing your mind based on new evidence.
I'm curious to what extent, and this is primarily members of the panel who address governance, you have looked at what other countries, and in particular the European Union, which appears to be more proactive.
We have looked at other nations as part of our regulatory oversight, and you get two things there. What is, on paper, and what is actually then being implemented, and sometimes those are two different things. I think Europe has been more proactive in the development of standards, has been more proactive in putting in place structures. Whether those have had a good or a bad effect is an open question.
And just aligned to that, a question about the development of independent standards. ISO, for example, is very busy now.
ISO's involved, ASTM, AMI. There are a number of standard-setting bodies that do get involved in this area. That raises, particularly for the U.S., that raises a couple of interesting questions. One is there are constitutional issues about delegation of lawmaking or regulatory authority to non-government entities. So can we simply say, okay, ISO, create a standard, we will now follow it? Secondly, that raises some interesting issues of...
The ISO standards sometimes are influential for industry.
Yes, yeah. The other issue you get with those are issues of democracy. You really don't have the same level of public engagement, public input into an ASTM standard as you do into a regulatory standard. Right? So you have this difference from just pure democratic theory between private or not-for-profit standard-setting bodies as compared to regulatory agencies.
I'll just add a comment that in Europe, for example, because cadmium is a heavy element, you will not find research papers from any laboratory coming on cadmium cyanide. Same way, they don't use calomel electrode for electrochemistry, they use silver chloride. So just because funding agencies don't fund these projects, they can't do the research. Most of this CAD cyanide, which Maria showed at the end, is coming from the U.S. Again, these are some of the other side of the story. When they put strong regulation, the science doesn't progress.
I wanted to push back a little bit on the anticipatory governance, your presentation, from the perspective that a series of scenarios without any associated probabilities starts to be kind of a meaningless exercise, I think. I mean, at least the way my mind works, the scenario has to have an associated probability in order to have an associated utility. And so, you want to speak to that issue?
Yeah. The sort of event that made scenario development and scenario planning a sort of professionally viable activity was planning in conjunction with Royal Dutch Shell that enabled Shell to respond to the 1973 oil embargo in a way superior than its fellow oligopolists. And that was a scenario that came without any probability assigned because everyone in the industry believed that oil prices would follow a predictable trajectory from that moment in time to any point in the future because we knew what the current price of oil was, we knew what the reserves looked like, and we knew what consumption was going to look like. And the rest of it didn't matter.
But we're not talking about Five Sigma events here. We're talking
well,
about
but maybe we are. Maybe we should be. Maybe we are.
your example, the chemist who's standing in front of that fume hood
Mm-hmm.
has a fairly significant exposure to chemicals over their lifetime.
Mm-hmm.
That chemist doesn't necessarily want a fume hood in his kitchen or when he's outside. So there are associated probabilities
Mm-hmm.
of being exposed to chemicals.
Okay. Mm-hmm. Well, this is, on the one hand, maybe part of the effort should in fact be to those probabilities that are not quantifiable. I mean, look at the economic costs that we just had from an utterly unpredicted, but in retrospect at least, yes, there's a psychological bias here, but we knew there were volcanoes in Iceland. We know which way the winds go. We know they interfere with jet flight, and yet nobody managed to be insured against that kind of thing. Okay? So there are that category of events, those incalculables, that scenario development helps create intellectual space for. And then one can have, I think, a reasoned discussion about what it is that we have a significant knowledge base to make some probabilistic forecasts, what we don't have the knowledge base for, to begin to consider what the plausible kinds of scenarios are. And, I think it's also the case that, and this is a discussion that I have with Alfred on occasion. Yes, there are important resource allocations that have to happen that one would probably want to happen under more rather than less information about the probability of potential outcomes. But if you think about what the situation is with nanotechnology, where, look back at EPA and the chemicals that we've got. There's still, 60,000 pesticides for which we don't have a risk assessment. It's 80,000 now. Okay, so sorry. We're not going to have the risk assessments for these things. What else can we do? And one of the things that anticipatory governance proposes is that we can look at the variety of outcomes and begin at least a process now of doing things that seems reasonable, that seems sensible for preparing for a multiplicity of potential outcomes. I mean, one of the places where this begins to go, for example, is what the folks at the Rice Center for Biological Environmental Nanotechnologies calls safety by design, okay? Since we're not going to be able to test all the individual nanoparticles, we don't know how to make them all the same kind of nanoparticle, why don't we think about what potentially makes them but nasty in biological systems and design them from stage one so that they don't have at least as many of those characteristics that we can control when we make them in the laboratory.
I'm an environmental geologist, I should state. We work on long time scales, and we've seen one after another environmental disaster because somebody thought MIT was a great idea and threw it out there before they knew the long-term consequences. I'm appalled that we have all these silver nanoparticles going out to the environment, for example, without any way of knowing what the long-term environmental consequences are. I think it's
situation of a practicality of sense, I'll tell you right now in the hospital, we have these errors all the time of dosages being 1,000-fold off with using heparin, and there are mechanisms we use to correct it. But that's something that the society doesn't see. And so these hidden risks, when the system is not structured very carefully in a practical sense, can ripple in ways that are quite oppressive. To that end, I also would like to point out that we talk about these risks, like the silver and going in the environment, but we have risks around us all the time that we need to bring in autonomy, these other aspects, like vehicles. My wife is a general surgeon. She treats people that are traumatized by cars and bikes and all the time. And the amount of fatalities that we have right now is standing at 45,000 fatalities every single year. That's a small city dying every single year. How does that matter with this? I don't know. The autonomy, everything goes into play. That's just something to think about.
By the way, JNR also stands by the Journal of Nano Research.
I have two things. First one's on this sort of unknowability that affects the expected outcomes, right? So we don't know how much we would want to purchase insurance for against certain kind of nanos, right? I mean, that's kind of the problem that was being raised, right? We don't know what the price would be for insurance against nanosilver in the environment because we have no idea what the costs are. But it seems to me that this is the point I think you were also making, that if you have a general kind of thing, like a new technology, all you have to do is look at the type rather than the token kind, right? So nanosilver, I don't know how bad that is, but it's a kind of technology, that's a type thing. You might be able to get an expected value for that. But this kind of thing in general historically has produced these kinds of effects, and you could develop an expected value that way. So I don't see why you couldn't do that. Maybe there's more precise problem with that, but I don't see why you couldn't do that. My question actually is for the first speaker. So I really enjoyed your presentation. I'd never actually seen the size of these things, and I thought that was really cool. I have to profess I'm not really a nano person, so I thought that was really awesome. I have a question for you, though, because you point out this nice distinction between the sort of behavior of molecules and the behavior of nanos. And there's all these questions, all three speakers have asked questions about how we might define or whether we should define nanos. And so I wonder if that's not the right way to go, kind of this functional difference, right? Look, when you have an object of this size, it produces new properties that something bigger doesn't have, right? So a big chunk of silver doesn't really do anything. You put it on your cut, nothing happens, right? But you make it small enough that it does something different, very different in fact. So why not define it that way instead of in terms of its length or shape, just whether or not it produces a new set of properties?
Yeah, so for example, if you take a silver nanoparticle that's round and a silver nanoparticle that's long and skinny, then they will both have a high energy plasmon band, a high energy absorbance of light. The long and skinny one will also have a low energy plasmon band. So the size and shape are mixed in with the properties. So if you were regulating on the basis of that high energy plasmon band, then you would miss something that's a potential near IR emitter. I don't know if that would have any health and safety risks, but you have to be really careful when you're doing functional regulation. That was the problem with the heparin example, right? They had a functional assay, and there was a contaminant that snuck in that had scored well on that functional assay and happened to flunk on the bioassay when you actually put that product into human beings. So I think it's going to have to be a mix. And yes, I think we need standardized tests. We need standard materials. If you're a geochemist, you can get Montmorillite clay that NIST probably keeps in a 50-gallon drum in their basement, but it's a standard material, and my ion exchange measurements will be the same as somebody else's ion exchange measurements. But if you want gold nanoparticles, then, well, maybe you buy them from a company, maybe you make them yourself, but there's no standardization of what the actual surface chemistry is going to be, heterogeneity of the particles. So I think it is the attempts to nail down the definition of the nanomaterial are they're problematical because of the analytical problems. So again, maybe having a functional definition is going to be part of the solution. I think it also has to be linked to structural characterization information.
Okay, I think we are running 3:15. We are to start the next section. Before we conclude, 20 seconds comment on your view you want to share.
Can we start at the other end of it?
Oh, okay.
I'm second no matter what.
Okay, just formulated while sitting up at this table. When we decided we wanted in the United States a large-scale industrial society, certain things came with it. If we decide that we want a wholesale innovation society, other things are going to have to come with that. Okay, so basically the connection between industrial capitalism on the one hand and the welfare state on the other hand, that and whether this is about people putting up with it or whether it's about a real substantive partnership and exchange, it can be up for interpretation. But we needed unemployment insurance, we needed old age insurance, we needed disability insurance in order to keep people working in a capitalist society. You see that across economies. When we want an innovation society, what are the kinds of things that we're going to have to provide alongside of a real emphasis on innovation, given the kind of uncertainty, often unquantifiable uncertainty, that innovation poses? What else comes along with it?
Three thoughts in no particular order. First, I think one of the speakers raised, auto accidents. When you look at nano in a broader context, how does this fit in terms of risk, relative risk, whatever, with other things in society? And is this an area where we should or should not be focusing time and resources if you want to look at broad public benefit, public health questions? That's an overall resource allocation, both in terms of money, intellectual space, et cetera. Secondly, if you do just a quick 2x2, chart with impact on one axis, probability on the other, where we always seem to stumble is in the high impact, low probability box. High impact, high probability, that's easy. The other ones are easy. And, what do you do for the 1 in a million? Probability, the nano that ate New York. And I think we face that problem across all technologies. I'm not going to beat on the definition issue anymore. People know that. I think as people think about it, we're really focusing on three conceptual approaches to what we do going forward. In no particular order. Do we do a radical redesign of the regulatory systems for nano, a standalone nano agency, whatever it happens to be? Do we tweak existing systems? Or do we say that the existing systems are adequate and provide appropriate levels of protection? I think those are conceptually the three broad pathways that as a group, as society, we have to decide which one we're going to go down.
I would just say that it seems sensible to look particularly hard at materials that are providing large doses to the public, which right now is probably nothing yet, but coming down the pike, maybe carbon nanotubes as those materials, those bats degrade. Anyway, that the poison is in the dose for toxicological purposes. So, it's a matter of resources. There are hundreds of millions of chemical compounds, and some of them are pretty nasty, but they're in the hood. They're not out in the neighborhood.
Okay, let's